lady from District 11.
Thank you, Mr. Speaker, and thank you, members of the House. I know it's getting late, and I've taken pages out of this and rewritten things, but I think I have another perspective that I'd like to offer to you. Before I begin, though, I'd like to thank everybody in this body, both Republicans and Democrats, for being so civil and so kind today. And this is really how we should debate and how we should be respectful and how we should work for our state. What I'd like to talk about, too, here is about PPACA itself. And I really want to address something that has been hit with me oftentimes, and I constantly hear that, well, but if you vote for this, then you're implementing PPACA. And I really want to make that clear, and I know the body knows that, but I'd like to make that clear to other people that that is not implementing PPACA. Things of PPACA have started to be implemented back in 2010, and I'll give you just a couple examples. 2010, they established a temporary national high-risk pool to provide health coverage to individuals with pre-existing conditions. To provide dependent coverage for adult children up to age 26 for all individual and group policies. Require health care plans to provide a minimum coverage without cost sharing for preventive services, and even to impose a tax of 10% on the amount paid for indoor tanning. People who have been tanning have been paying a tax for 3 years. PPACA has already been here. And for those of us who have health insurance, and especially those of us in the body who have insurance through the state, if you have a health insurance policy, it's a product already of changes because of PPACA. It is here. And we do have to understand that. And some of us think they're good, some of us think they're bad, but that is a separate issue. What I really want people to understand, though, is if you look at the whole situation, PPACA was implemented back there in 2010. And what happened was you had a president who basically had control of the House and the Senate. If the federal government at that time wanted to institute a socialized medicine, wanted to institute a federal exchange where they had complete control of all the issues, they certainly had the willpower to do it, and they owned both houses and could have done it. And what came out of that was that is not what happened. There was actually an option built into PPACA for the states to be involved. And I'm really actually quite dumbfounded that we're fighting over having the option. Why wouldn't we want to have the option? Had the federal government simply stepped in and handled it all and took control over all of it through Congress, we wouldn't even be having this conversation. And we wouldn't even be having the debate. But I'll tell you what, I'm going to stand up here and be glad that we're having the conversation. I'm going to be glad that we're having the debate. And I'm going to choose the option every single time when it's there. Because someday it may not be there. And that's why we are going to vote yes on 248, because we want to preserve our option that someday in the future may not come around again. I also would like to just stand here as a conservative Republican with the rest of my party. I know that my party are conservative. I'm pro-life. I prefer local control. And I've always run on the premise that I'm an independent thinker and I'm not mired in strict ideology. I support the Idaho businessman and the over 500 businesses which have asked for a state-based exchange, and the many constituents who have asked for that as well. We heard that it was talked about how the people that came in and the only ones in support were the lobbyists that stood up for these organizations. And lobbyists did stand up for those organizations. But I want to remind you that those organizations are our businesses here in the state, who employ thousands of people, who pay their taxes, and who are going to be directly involved with PPACA on a number of levels. And I'm kind of glad that the lobbyists stood there instead of the thousands of people that would have had to come through the line. But the point is, those businesses said, we want to work with our state. Do not have us work with the federal government. And really, as a businessman, it has always seemed to me that eventually the businessman ends up being the one that holds the bag. And so for those 500 businesses that said, please let us work with the state, then I think we owe that to them, to listen to them. Communication in my district, really overall, if we counted it all up, for a state exchange has been very, very positive. Businesses and individuals. Absolutely very positive. And so I'm going to stand up for them. And one other thing that I want to talk about is There have been a number of people in the body here who we've had an opportunity to work on this bill for the past 3 years. And it's been delayed, it's been stalled, it's been changed, it's been a whole lot of things. But time is up. There is no more. We have deadlines. Our Health and Welfare Department that is in charge of Medicaid has deadlines they have to meet. And I am going to tell you that they have a responsibility to take care of the citizens in our state here who, unlike us, and those of us sitting in here, they absolutely are dependent on medical care for their very lives. And we can't play this game anymore and put people at risk. It's simply time to go ahead and take the vote. And that's what we need to go ahead and do today. The other thing that I'd like to mention here is that there have been a number of people who have worked on this bill, who have made changes, and I'm very proud that people have come forward to do that. I think that what's important here is that we want to be sure that we are not worried about our elections. We should not be worried about our personal legacies, and we should not be worried about ourselves. We should be worried about the citizens of the state of Idaho, and we need to do the absolute best job at this point in time, under the circumstances that we have now, to protect our citizens and support them the best that we possibly can. And I want to say that Idaho should be a leader. We should not be a follower of the 25 other states who just want to acquiesce to the federal government. I don't think that that's the best way that we should go. We need to embrace our option, and we have an option. And that's what's really important here. And that we need to embrace that, and we need to work through that and make it the best option that we can. This is a starting point. And as we go through the years, we will have other opportunities to keep working on this so that we always take care of the people of our state first. And I think we really need to keep that in mind. So I encourage all of us to simply just go ahead and take the vote. We don't need to debate 2-3 times. I don't know how many times you can kill a horse. I think we've covered probably just about everything. So I encourage us to take the vote. I would surely like to see our House put back together, and so that we can all work as a whole group to take care of our citizens and to help make Idaho as successful as it can under whatever circumstances happen to come our way. And thank you very much, ladies and gentlemen.